Hello everyone, this is Dhruv. I am a third year MBBS student from Dr. N.Y. Tasgaonkar Institute of Medical Science. Hello everyone. So this is the first lecture of direction. Now you might be wondering, okay, leave everything aside. I don't care who you are. Why are you starting with respiratory pharmac? Most of the people, or ideally, it should be started with general pharmac. But listen, there is like if I'm right now taking up respiratory pharmac, it is very important that I don't go with general pharmac सबका strong होता है, ANS सबका हिला हुआ होता है, and most of the people don't focus on these smaller sections. So I thought, why not पहले complete the smaller sections, which are also very important, by the way, which people don't give attention too much. So that is why I feel a respiratory pharmac is a good unit to start with, right? It's very important, it's very relatable. आपको आजू बाजू के काफी लोगों को people, what is the most basic thing people have? Cough. What is the most basic thing people have? Bronchial asthma. So it will be more relatable for you all guys, right? So that is why we are going with respiratory pharmac. It's a very informative unit, बहुत मजा आने वाला, and I'm sure that you guys are gonna love this channel, and I hope that I turn pharmac very well for you. Now, before we begin, a few quick introduction, a few pointers to let you know when you come into my classes, because this is the first lecture. So consider the next 5 minutes as the orientation, right? I know most of the people don't want to hear it, and I don't want to bore you as well, but I'm going to start with the most basic thing, that is to pay attention. Now, my lecture length won't be 1 hour to 2 hours. I'm going to make sure that it's very cut forth and it's very cut short, so that your attention span increases, right? And trust me, the happiness of students when they see that a lecture is just 15 to 30 minutes long, it seems very doable, है ना? वो psychology ही वो हो जाती है कि I'll complete this lecture. So that is the only reason why I'll be taking my lectures in a span of 15 minutes to 30 minutes. I won't exceed. Some lectures, yes, very rarely, but I'll make sure that I stick to my timeline of 15 to 30 minutes. Now, in that timeline, I want your attention span to be 100%. Grab a cup of coffee, grab a cup of chai, and make sure that you put your phone on DND. Hannah, if you're watching on the phone, then also try putting on DND. Download my lecture, try putting on DND. And I don't want any messages, I don't want any calls interrupting in between. Sir, we are MBBS students, we are not nursery kids. I know that, but it is very important, Hannah, right? Second thing which is there is that जो notes आपको आपकी स्क्रीन पे दिख रही है, वही notes मैं आपको टेलीग्राम पे भेजूंगा. Okay, so do you mean to say that Telegram is the source where I'll be getting all my material of direction? Yes. डायरेक्शन के दो ही सोर्स हैं, यूट्यूब फॉर द वीडियोस एंड नोट्स के लिए, क्यूबैंक्स के लिए, असाइनमेंट के लिए, फिलिंग द ब्लैंक के लिए, फ्लैश कार्ड्स के लिए आपको टेलीग्राम पे जाना होगा, राइट? सो वेरी इंपॉर्टेंट, आई डोंट वांट यू टू गेट कंफ्यूज्ड. टेलीग्राम फॉर द मटेरियल्स टू स्टडी एंड वीडियोस के लिए. सो जो नोट्स आपको स्क्रीन पे दिख रही है वही नोट आपको टेलीग्राम पे भेजी जाएगी. तो व्हाट इज द यूज, व्हाट इज द बेनिफिट, व्हाई आर यू पॉइंटिंग दिस आउट? आई एम पॉइंटिंग दिस आउट बिकॉज आप जब ये नोट्स को पढ़ रहे होगे क्लास में, आई वांट इट दैट यू रिवाइज द सेम नोट्स. आई डोंट वांट यू टू गो फॉर केडीटी और शार्पनर. व्हाट आर यू सेइंग? केडीटी और शार्पनर में पढ़ने नहीं चाहिए? अरे मैं आपको क्लास में पढ़ाऊंगा केडीटी और शार्पनर. We'll have reading sessions of KDT, we'll have reading sessions of Sharma. रुक जाओ, अभी पहला लेक्चर है. You will come to know what direction is doing and what direction is going to produce. Right now, just focus on what I'm saying. आपको जो नोट्स दी गई है स्क्रीन के ऊपर, वही आपको टेलीग्राम पे दी जाएगी, वही आप रिवाइज करोगे, so that the revision goes faster. What you learn in the class will be causing a faster revision if you download the same notes from Telegram. समझ में आया है ना? So that is my third pointer which is there. Also, we will be doing KDT reading, Sharpbug reading, so that your KDT and Sharpbug is not missed out. Sir, let's come to the main business. Let's talk business. This is all fine. You know, I have thousands of platforms where I can study my NEET PG with. What about the prof examination? Exactly. We're going to discuss every short question and every long question. Yes, I will make sure that I make you discuss every short question. I will provide you with the markings if I don't have the question and answer written in handwritten format. I'll give you markings from KDT, I'll give you markings from Shanbag, and I'll make sure that I prep you up properly for your long answer and short answer question as well. Okay, so these are some few orientation point. Sit back nicely, back straight. Make sure that you just grab a nice cup of coffee or a chai if you have accessibility to, and start with my lecture. Be very attentive. What are the points? YouTube पे video, Telegram पे materials to study. Put your phone on DND and download my lecture so that there is no interruption. Third, whatever notes you study in the class, same notes you'll have to revise so that the revision goes faster. We will do KDT and Sharpbug readings, so you don't have to worry about that. And we will also, I will also prep you up for SAQ and LAQ, that is the short answer question and the long answer question. Without any further ado, just make sure that you pray to you give your offerings to the universe, to Almighty, and you start this lecture with a very positive note. Now, before we start, Farmac is a pain. You know, it is a pain for most of the people. But there are two extremes. There are some people who are very good at Farmac. Unka Farmac makhan ki tarah jata hai. There are some people who don't like Farmac. They can't retain the Farmac. बीच वाले लोग कभी देखे मैंने, बहुत एक्सट्रीम्स देखे मैंने फार्माकोलॉजी में, and I really hope that direction is a turning point for you guys where you just fall in love with the subject. It's a beautiful subject. Oh my god, it's like the love of my life. If I talk to you about Farmac, obviously after chai, if anything comes as a love of my life, it has to be pharmacology. Let's not talk too much. Let's dive straight to the business. So firstly, we are going with respiratory Farmac. The first section of it is cough. Bronchial asthma करेंगे दूसरे लेक्चर में. राइट, अभी फोकस ऑन कफ. कफ कितने प्रकार, अच्छा चलो इधर देखो, नोट्स नहीं पढ़ना है. कफ कितने प्रकार के होते हैं? दो प्रकार के कफ होते हैं. एक होता है ड्राई कफ, एक होता है प्रोडक्टिव कफ. यस, अगेन ड्राई कफ, प्रोडक्टिव कफ. ड्राई कफ में सूखी खांसी आती है, इसका मतलब स्पूटम नहीं है. और प्रोडक्टिव कफ में स्पूटम आ रहा है. यस, ड्राई कफ के दो प्रकार होते हैं, है ना. कोई भी आपने देखा होगा आजू बाजू खांसते हुए, तो दो प्रकार के होते हैं. एक जिसमें बलगम आता है, स्पूटम आता है, प्रोडक्टिव कफ. और जिसमें स्पूटम नहीं आता है, ड्राई कफ. जिसमें स्पूटम आता है ना, क्या हमें उस कफ को दबाना चाहिए, उस कफ को कंप्लीटली बंद कर देना चाहिए, या फिर उसे ऐसी गोली देनी चाहिए जाके उसकी स्पूटम जो कफ आ रहा है वो थोड़ा इजी हो जाए? What I'm trying to say is that in dry cough when there is no sputum now, बहुत इरिटेशन होता है. सूखी खांसी में बहुत इरिटेशन होता है. So we give the patients वैसी दवाई जहां उनका खांसी बंद हो जाए, क्योंकि स्पूटम नहीं आ रहा है, कुछ नहीं है, it's just causing irritation to the patient. But in productive cough patient, I don't recommend that, or rather anyone would not recommend that you give such दवाइयाँ where the cough only stops. No, अरे स्पूटम निकल रहा है, स्पूटम में there are foreign bodies, there is bacteria, there is virus, either, right? There is all the foreign bodies, दुनिया भर की foreign bodies. Do you want that to stay in the body? No, you want it to be out of the body. So you won't give that medicine जिससे कफ बंद हो रहा है. ड्राई कफ में देंगे कि स्पूटम नहीं आ रहा है, इसमें स्पूटम आ रहा है, तो हम वो स्पूटम आने के प्रोसेस को इजी कर देंगे. समझ में आ रहा है ना. ड्राई कफ में स्पूटम नहीं है तो बंद करना जायज है. प्रोडक्टिव कफ में स्पूटम है, बैक्टीरिया है, वायरस है, फॉरेन बॉडीज है. डू यू वांट टू स्टॉप इट सो दैट इट रिटेन्स इन द बॉडी एंड कॉजेज मोर हार्म? नो, वी वांट द प्रोसेस टू बी इजी. यस, ठीक है. तो जो हम ड्राई कफ में दवाइयाँ देते हैं उसे हम लोग एंटीटूसिव्स कहते हैं, और प्रोडक्टिव कफ में जो दवाइयाँ देते हैं हम उसे म्यूकोकाइनेटिक्स कहते हैं. क्यों म्यूकोकाइनेटिक्स? म्यूको मतलब म्यूकस, काइनेटिक्स मतलब मोशन. तो म्यूकस का मोशन इजी हो जाए, दैट इज व्हाई वी डू इट इन प्रोडक्टिव कफ. यस प्लीज, एनी डाउट्स? वेरी सिंपल नो. हाँ चलो इधर इधर इधर. कफ कितने प्रकार के होते हैं सर? दो प्रकार के कफ होते हैं, ड्राई कफ, प्रोडक्टिव कफ. सर ड्राई कफ में जो है उसमें स्पूटम नहीं निकलता. सर प्रोडक्टिव कफ में स्पूटम निकलता है. ड्राई कफ में कफ को बंद करना लॉजिकल बनता है क्योंकि स्पूटम है नहीं, खाली फोकट का इरिटेशन दे रहा है पेशेंट को, वी विल गिव एंटीटूसिव्स. प्रोडक्टिव कफ में कफ को बंद करना सेंस नहीं बनता है, ऑलरेडी बैक्टीरिया है, ऑलरेडी वायरस है, ऑलरेडी फॉरेन बॉडीज है, वी वांट इट आउट ऑफ द बॉडी, वी डोंट वांट इट टू बी इरिटेट क्योंकि वो हार्म करेगा. तो एंटीटूसिव्स नहीं देंगे, म्यूकोकाइनेटिक्स देंगे. राइट, तो रीड कर लेते हैं. ड्राई कफ इज जस्ट इरिटेटिंग द पेशेंट, सो टू ट्रीट इट वी स्टॉप इट. व्हाट डू? वी टेक एंटीटूसिव्स और वी गिव एंटीटूसिव्स, है ना. Productive cough में there is release of the sputum, hence we should not stop it, वरना harmful bacteria will remain in the body. Right, we want the person to cough, हमें चाहिए कि वो कफ करके बाहर निकाले, so that the sputum comes out, hence the coughing should be easy for the person. That is why we do mucokinetics. Right, ठीक है. What are the example of antitussives? Antitussives are codeine, folcodeine, dextromethorphan, noscapine. Sir, why are you smiling? Okay, I know that this is your first lecture, okay, but आपने कभी ना कभी तो फार्मैक पढ़ा ही होगा, है ना. Obviously you know फार्मैक, ऐसा तो नहीं है कि you are starting with me fresh. कहीं ना कहीं colleges में या दूसरे platforms, so obviously you have understood फार्मैक. What do you think? What is codeine, folcodeine, dextromethorphan, noscapine? What are these kind of drugs? Under which class they fall? Yes, opioids. They are opioids. So opioids as antitussives are given in the person suffering from dry cough to stop the cough. What are they? Codeine, folcodeine, dextromethorphan, noscapine. Come again. Codeine, folcodeine, dextromethorphan and noscapine. Very good. Now in mucokinetics, sir, what is this classification? What is expectorants and mucolytics? Now the doubt that should arise in your mind is, okay, why, how are we doing this mucokinetics? How are we making the cough easier for the patient? See, why I do these hand actions so that you remember in exam. है ना. I have no bloody intention कि मैं ऐसा करके आपको पढ़ाऊँ, but the whole point is, I'll tell you why. In my college, when I give presentations, I always make sure that I do some kind of weird hand action so that people remember it कि हाँ उसने ये बोला था. So that is why whenever now you study mucokinetics, you will do this. Right. So in mucokinetics, how do we do that? How do we make the cough come out easily? One is by diluting the cough and one is by breaking the cough, है ना. So what I'm trying to say, in productive cough sputum निकल रहा है, we give mucokinetics, but there are two types. One that will dilute the cough and the one which will break the cough. जो dilute कर रहे हैं हम उसे बोलते हैं expectorants. Yes please, where is it? Expectorants. Expectorants, these type will increase the respiratory secretion causing dilution of the mucus, है ना. और जो mucolytics है, they will break. The name only says that lytics, mucus को break कर देंगे. Mucolytic is a type of mucokinetic. Expectorant is a type of mucokinetic. What are they doing? Making the cough easier to come out. Patient को आराम रह रहा है ना. जब वो मतलब when he's coughing or when she's coughing, it is easier for that person because we are giving mucokinetics. What are the example of expectorants? Guaifenesin and potassium iodide. Yeah, potassium iodide and guaifenesin. And what are the example of mucolytics? We will remember A, B, C, D. Yeah, ambroxol. Yes, ambroxol. Bromhexine. Yes, acetylcysteine. Yes, and Dornies. Yes. Sir, what is expectorants? What is mucolytics? Sir, expectorants are increasing the dilution of the mucus by which it goes easily out of the body. And what about the mucolytics? They are breaking the mucus by which it will go easily out of the body. Yes, please. We are finished with the lecture. Mhm. 2 minutes and we'll revise. Okay, 2 minutes we will revise and then we are done with the first lecture. यस टुडे वी स्टार्टेड फ्रेश. हमारा पहला लेक्चर था. हमने दो चीज सीखी. हमने सीखा कि व्हाट इज ड्राई कफ एंड व्हाट इज प्रोडक्टिव कफ. ड्राई कफ में सूखी खांसी आती है, स्पूटम नहीं आता है. So it is causing irritation to the patient. That is why it is making more sense that we stop the cough. We give antitussives. Antitussive आंख बंद करके बोलो कौन सी दवाई है? कोडीन, फॉलकोडीन, डेक्स्ट्रोमेथॉर्फिन, noscapine. What are they? Opioids. Right? I don't expect you to remember because it's your first lecture, but I'm sure कहीं ना कहीं अपना फार्मेट में पढ़ा. What about the productive cough? Productive cough is that type of cough where जहाँ sputum आता है, comprises of bacteria, comprises of foreign bodies. You don't want it to stay inside the body. So we will give, yes, mucokylytics. Mucokylytics will make the coughing easier for the patient. Mucus जल्दी आसानी से बाहर आ रहा है. Mucokylytics are of two types. One which will dilute the mucus and make the process easier, and the one which will break the mucus and make the process easier. Mucolytics are ambroxol, promethazine. ए भाई guaifenesin potassium iodide नहीं है, मैंने mucolytics पूछा है. Ambroxol, promethazine, acetylcysteine and dormase. And what about the expectorants? Potassium iodide and guaifenesin. I hope you had a nice time in the lecture and I'll meet you in the lecture too. Bye bye.